Is in the wings saying we got a party going on here. That's what it feels like, Jeanette.
Yes, well, you know me, I always make exciting shows.
Well, we have, I don't know what's going on now, except that we have Dr. Corey Torgensen here, and we're going to find out a little bit about Botox and other stuff, right,
Yes.
Jeanette?
Well, I think we should mention that it's Dr. Corey Torgensen from Facial Cosmetic Surgeon. It actually, for facial cosmetic surgery is the correct name of,
Right.
of your office.
Absolutely.
Your clinic, and it's a pleasure to have you here. I've been bugging you for about a year now.
Thanks,
to
Jan.
get you here.
I love it.
But I don't take no for an answer. And yeah, we're going to talk today all about what we should know about our next Botox shot and other facial cosmetic procedures. But before we get to that and your demo, I want to hear a little bit more about Dr. Corey Torgensen.
Okay.
So, first of all, what made you specialize in facial cosmetic procedures over doing like all aspects of cosmetic surgery?
Good. So, facial plastic or facial cosmetic surgery is a subspecialty of otolaryngology, head and neck surgery. And everybody knows that as ear, nose, and throat surgery. So I'm a head and neck surgeon first, and then I've done my fellowship training in facial plastics and reconstructive surgery. So why did I go there? It's a good question. I just loved the detail and the intricacy of what you could do and how you could make people feel when they look better and when they feel better about themselves. So it's a little bit of the detail, it's a little bit about the design for me, and for sure it's a lot about how people feel when they leave my clinic.
Okay, so Botox is a hot topic,
Yeah.
and it's been in the news a little bit lately, and I think that, you know, there's some scare in it to some viewers and to others not. What are the things that we should know about Botox before we take the shot?
Yeah.
And, you know, and where we should be taking those shots? And if you can answer those two-part question there.
Yeah, for sure. I think it's a really great question. I think we need to demystify Botox. A lot of people have no idea what it does. A lot of people think it's a filler. Botox is a neurotoxin, and it's a completely natural product. It's forever been around, and it's made by a bacteria called Clostridium botulinum. And you know, in the old days before we had fridges, these bacteria could potentially grow on food. And because the protein that this bacteria makes is a neurotoxin, it helps to, well, it doesn't help, it blocks neuromuscular action. So the muscle is alive, but it's actually not able to contract as much. So, you know, therapeutically, we've been using Botox for just about 100 years for people that had cerebral palsy, or if they had muscle spasms, or even if they sweat too much. Botox could help those people. And in Canada, it's been around for about 20 years now, 21 years. On the other hand, we've been using Botox cosmetically in Canada since 2001. And so, you know, you can use these on muscles that we overuse. So that's exactly what Botox does. It helps to relax muscles that we overuse. And in particularly in the head and neck, these are the muscles that can cause what we call dynamic wrinkles. Wrinkles that are caused by the muscle use. So a lot of people, you know, overdo the expression in between their eyes. You know, we call those the 11s or the crow's feet. Well, there's many places around the face that you can use it. But Botox isn't a filler. It doesn't add volume. It can just relax muscle. And Janet, I think one of the biggest important messages is Botox can be done safely and naturally.
Okay.
And where should it be done? Like there's clinics like yourself, and then there's the backroom Botox places, and I think we should know the differences in where it should be done and why it should be done.
And I know it can be done safely, but can it be done, you know, if you're doing it in a backroom location or by a person who doesn't have the right qualifications? Are there risks potentially if it's not done properly?
Absolutely. Safely and naturally. So safely. Right now in Canada, the only people that are regulated to do Botox are physicians. And you know, while all physicians potentially could do Botox, you want to have a physician that understands the map. If you are relaxing and potentially temporarily paralyzing muscles. You want someone that understands the anatomy, where those muscles are, because some muscles constrict and some muscles pull in a certain way, and if you don't understand the anatomy, then you can run into trouble. Doctors also right now are able to allow nurses to be able to do Botox as long as they're in the room and as long as they are sort of overseeing it. So right now those are two places. So you run into a bit of trouble, as what's happened is that people always like to push the boundaries and the lines of where this can be done. So you're having some physicians, unfortunately, taking control and saying, oh, I'll represent all these nurses or other people, and they're doing it in gyms and they're doing it in certain spas, and nurses are doing it in people's house and out of their car. And you just run into problems because it is a medical procedure. It needs to be done in a proper clinic. It needs to be done by people that do understand the anatomy, that do understand the dosing. I don't know if you've heard, but there was a recent story that came out where you could actually buy Botox through the net. You could have it shipped to your home. It probably came from China. It was cheap, and it came with a little instructional DVD.
Do-it-yourself.
Of do-it-yourself Botox.
Wow.
So you'd be injecting yourself without even knowing where to inject yourself.
Or injecting your mother, or injecting anybody. It's ridiculous. And so the safety message is really, really important. It can be done properly. It can be done safely. Just need to go to the right people.
Because we've heard stories like of the person who's had it done and then they can't smile anymore or something like that.
Right.
Right?
Or worse, they could die if it's not done properly, or lose the use of an eye or something.
For sure.
I mean, I've seen women have it done that are like pitch black under the eye. Is that normal?
Yeah. Well, Botox isn't injectable, so that means we got to use a needle. And Mia
That's scary all
scary, yeah.
right off the bat.
It's needles, and with needles that you can bruise. But we all can think of like celebrities that overdo Botox. We think of maybe Nicole Kidman and the whole mask face scenario. I can assure you that just about 99.9% of my practice, people come in with the same message. They just want to look natural. They just want to look refreshed. They don't want to look like anybody different, but they just want to look like they were, away in Hawaii for a week and they came back looking refreshed. And that's kind of with any procedure, whether that's fillers or surgery. The truth is that people don't want to look different for the most part. The cat ladies of New York
and the
housewives. They're a tiny, minuscule percentage of the population, and there is that. But by and large, most people just want to look fresh and natural.
Do they not also want, well, maybe in the case, and I know it's not just for women anymore, right? I think it's good to say that it's men too that are not just Botox and Restylane. Maybe we should define the differences, but other cosmetic procedures as well. Like, maybe you could sort of tell us like what's new and hot, and
sure.
What men are getting, what women are getting, and are they doing this to look better, or are they doing this to look younger? Because we were talking a little bit earlier about the personal branding and how it's competitive in the job world, and sometimes when you want to get a job and you're like 45 and you're competing against a 25-year-old, you want to have something to make yourself look younger and more competitive.
There's no question about it. In my practice, it's about 45% men, 55% women. Now that's a much higher proportion of men than are the average stats across North America. We live in a very urban center where there's lots of professionals, and men are starting to get it. And that message that you were saying has been on the show all day today, which is you just be the best that you can be. You be the best you. That's what people want. They know that they want to present and put forward their best possible them, and in a natural and an authentic way. And whatever you do, whether that's dressing or working out, eating healthy, looking after your skin, you want to do the right thing at the right time, and you don't ever want to overdo it. And so to answer your questions, what's hot? What's hot, honestly, in my practice right now is doing the right thing at the right time and not looking different. I tell you, there's a lot of people and money that with money in this city that spend a lot of money to not look like they've been done. And it's just becoming more and more popular just to look fresh and natural. And people are sick and tired of seeing the women with the overdone lips and the overdone cheeks and the overdone nose and the overdone facelift. They just want to have it properly, restfully, naturally done, authentic to them. And you can use a variety of different things. You can use anything simple from what we're talking about today, Botox or fillers. By the way,
define fillers, because not everybody knows.
For those of you that don't know what fillers are using a product to inject into the skin or sometimes just below it to volumize the skin, to create lift in volume. So we all age in the same way, right? We sink and we sag. We in essence, we're like big beach balls that deflate, and then that skin just sinks to the ground with gravity. And so fillers, Restylane, which is a hyaluronic acid, and then there's other products that you can use as well, Radiesse, or some of the new Self-Fill, which is a platelet fibrin product. These can all be used to potentially volumize and create lift. So Botox relaxes muscle, fillers volumize and, in essence, inflates.
Okay, what other things do you do at your clinic? I mean, this is a facial cosmetic clinic that specializes strictly in the face.
That's right.
So obviously Botox, Restylane, filler, but what else? Facelift, eye lift?
Absolutely. So we do facelift and neck lift. We do eyelid surgery, which is called blepharoplasty, uppers and lowers, forehead or eyebrow lifts, ear surgery, and we do liposuction and anything from lasers to fillers, just like what you said.
But only on the face, right?
Only on the head and neck. And the landscape of those that primarily do cosmetic procedures are the general plastic surgeons. They do the body work, and then there's the facial plastic surgeons. And by and large, they're limited to the head and neck area, their specialty. So as we're becoming more and more focused in medicine, we tend to choose the kind of surgeon or doctor that specializes in the area that we're trying to target.
Right, but if you're...
Did I also say rhinoplasty?
Yeah, rhinoplasty. No, you did not say that.
Okay.
It's nose jobs,
Yeah.
or as they were formerly known. So let's say if you're having facial cosmetic surgery,
Yes.
and you're aging,
Yes.
would it make sense then that you'd have to do your body at some point too to make your face look as good as your body?
You know what? It's your last guest said that the eyes are the window to the soul, and so it was a really good point. It's true on many levels. When we look at people, where do we look at them first? Their eyes. And so it's really actually the first place that I would probably target on just about anybody is the eye area, and then you can move to other areas. We always look at people's heads first because it's where their eyes are in general. So if you have lots of volume in your face, so I always say it's your face or your butt. And if your face looks fantastic, it usually means you got a lot of volume in your face. And if your butt looks fantastic, it usually means as you're getting older, you have too little volume in your face. So, be who you are, do the best that you can with your diet, and do the right thing at the right time. So if it's to your body, absolutely, I'm all for that.
Okay, I had. Do you have a question? Because I have another one.
You keep going, Jeanette.
Okay, I'm very into this stuff, as you can see. I just wanted to ask if there's anyone who shouldn't have Restylane, Juvederm, or Botox for a medical reason or diabetic or something like that. Is there anyone that shouldn't have it?
Yeah, she asked the best questions. Jeanette, people that should not have Botox includes those people who are pregnant, those people that have neuromuscular disorders. There's one called myasthenia gravis, should not. If you have a recent herpes outbreak, like a cold sore on your lips, you shouldn't be getting needles in your face. And sometimes if you have some certain disorders that predispose you to, again, muscular spasming and that.
Like MS or something of that nature?
Yeah, it can. You have to be careful. But people that, with regards to the fillers, it's a little bit more open because it's just a volumizer. Basically, if you have a specific